So welcome everyone to the Just Ask, Launch and Learn, which is hosted by the Ottawa Collaborative for Parenting Support, OCPS, a task group of the Ottawa Child and Youth Initiative, which is OCYI. So the Just Ask initiative is a partnership between OCPS and 4 organizations, one called OneClick.ca, Parenting in Ottawa, Parent Resource Center, and 211. These organizations offer a variety of programs and services to support families. We are glad they are here and will share more about their impactful work in their presentation. So thanks for taking the time to join us today despite your busy schedules. So my name is Mariama Regbeshola, one of the co-chairs of the OCPS task group, alongside Caroline Gerard. I will start with a land acknowledgement. We meet today in Ottawa, which is built on unceded and unsurrendered Algonquin and Anishinaabe territory. The peoples of the Algonquin and Anishinaabe Nation have lived on this territory for millennia, and we honor them and this land. We acknowledge our role as settlers in this land and are committed to working towards equity, inclusion, and mutually respectful relationships with Indigenous communities. Their culture and presence have nurtured and continue to nurture this land. OCYI also honors all First Nations, Inuit, and Métis peoples and their valuable past and present contributions to this land. February is Black History Month, and we would like to acknowledge and appreciate the contributions and achievements of Black and racialized people throughout this month and throughout the year. Black History Month is an opportunity to honor the past, celebrate the present, and pave the way for a more inclusive future. Let's continue the conversation, learn from each other, and work together to ensure our workspaces and communities remain a place where everyone can thrive, belong, and succeed. Feel free to use the Q&A box for any questions, which will be answered briefly at the end of each session. Each organization will be speaking for about 10 to 12 minutes, with 1 to 2 minutes to answer questions. So we'll start with one called OneClick.ca, represented by Michelle Douron. Parenting in Ottawa, represented by Genevieve Mosha. Parents Resource Center, represented by Kristen Holinsky. 211, represented by Daniel Danford Dussault. So welcome again, everyone, and over to you, Michelle.
Thank you, Mariama. Okay, I'll just share my screen here. I apologize, I'll be looking a little to the side because I have my presentation on a separate screen so I can see it properly. So thank you for having me here today. I'm here to represent OneClick.ca. My role within OneClick is actually care coordination worker, which I'll be speaking about a little bit further down in my presentation. So OneClick.ca was an initiative by the Kids Come First health team, which brings together mental health, addictions, and substance use health table. And it's really about transforming and coordinating the access and navigation of services within the entire Champlain region. So the vision was really to have children, youth, and families be able to get the right care when they need it so they can be themselves, with a mission of providing supportive, coordinated access, navigation services in a way that really integrates all the trusted and safe mental health addictions offered within, again, that entire Champlain region. So it's really that idea of having one place to go. So when I say the entire Champlain region, I really mean from going from Pembroke all the way to Cornwall and everything in between. So we cover that entire region. It has, we have partnered with, we have intake workers from different organizations throughout the Champlain region. We have mental health agency partners to service match to youth, family and youth partners, as well as other contributing partners. So there's a huge list. You will get the presentation after. I won't go through all of everybody here, but as you can see, there's many, many organizations who are involved in this piece. Sorry. Don't know why it's not clicking forward. I'll just go, there we go. Okay, so what is it? It's literally one call, one click. It's one place to go in order to get your mental health and substance use addictions needs met. So you can either call, we have a phone number that people can call which will be at the end of the presentation as well, or they can go online at the onecallonclick.ca website and book an appointment. This can be done by a family member. It could be done by any third-party care provider. It could be done by their medical professionals that are involved in their life. Appointments can be done either over the phone or virtually with the family, whatever their preference might be. Services are available not only in French and English, but they have access to interpreter services as well, so it can be offered in any language of the family's choice. We then match to the most appropriate services, helping them navigate the system. So a lot of times families who are dealing with mental health, substance use, and addictions are not too sure where to go. So the idea is to have this one-stop shop of, okay, I'm going to do an intake, and then I'm going to be matched to a service. For many of our partners, they will actually take the intake from One Call, One Click as their intake and match them directly to services. For some of the more complex support, sometimes they will require to do a more in-depth intake with that particular team. For example, with the CHIO outpatient mental health team, they will do a further assessment based on the needs at that point. And on top of all that, there's also some hands-on care coordination that can be referred to, which is myself and my colleague Danica, who provide this care coordination support. Again, we'll go into more detail on that. And there's some family peer support. Again, so it's not always just mental health. Sometimes we have parents who want services and support, and you have a youth that's over 12 who's not consenting to services. So we do try to support that parent as well in the best way we can, understand that we may not have consent of the youth at that time. So who do we serve? So we do serve 0 to 21, we'll say. So from infants, children, and youth to the age of 18 for mental health services, and then for substance use and addictions up to the age of 21. We cover Ottawa, Pembroke, Cornwall, Coxbury, also surrounding areas, Lanark, Leeds and Grenville, Stormont, Dundas, Glengarry, Prescott Russell, and Renfrew. We're far-reaching. We have intake workers from pretty much every one of those areas for the most part. So again, when they're calling, even when we're matching with the intake worker, we try to match with people who are well-versed in their age group, but also in their area whenever possible. And it can also help navigate systems for the primary care providers, family doctors, different organizations, school boards. We'll often have the schools calling, saying, how can we help support? Always ready to answer a call and provide that additional support when needed. There's a number of services that are offered through One Call, One Click. So it's really about integrating as much as possible of having that one-stop shop, as I said. So we provide information about the systems and the different resources. We do navigation and matching to these services, the care coordination for complex needs, and can also support with transitional aged youth who are moving from childhood to adult services. There's peer family supports. We are also the intake process for the mental health and addiction nurses. So the MAN program, which works in collaboration with the schools. So mental health and addiction nurses when there's both mental health and school challenges, they could come in and support with any nursing needs, any new medication that they're not sure about, side effects, concerns, any questions around education around medication, and that they will help support with that. They'll help with safety planning in the school and all those pieces. So the schools can make referrals. Again, anybody can make a referral. And sometimes when we're doing that intake, we might feel like that might be an additional support that they can access. And their wait times are usually pretty short. Within a week or two, they're normally matched to one of the mental health nurses. And then the newest program that was actually amalgamated within the One Call, One Click umbrella, if you will, is the school-based mental health treatment team. So those day treatment programs within the English school board, so the Ottawa Catholic and the Ottawa District School Boards, all referrals for day treatment programming now go through One Call, One Click. It's a different team than the intake team, but it's all amalgamated together, which helps with that transition and support going through. Okay. Considering it's my program, I did want to spend a little bit more time talking about what is this care coordination. It's probably the less known service within One Call, One Click. So referrals do have to go through One Call, One Click. So the intake workers, if they feel that there is a case that comes through to them, so 0 to 18 with more multiple complex and acute mental health needs, and that they feel that won't be justly served with just matching them directly to a service. A lot of these families have tried everything. They have not had success, or there's some complexity. Sometimes it's the parent mental health that's getting in the way, that causing barriers to accessing these services. Whatever the needs may be, if we're finding that there's a higher level of complexity and acuity, a referral can be made to the care coordination team in order to provide this additional hands-on catch and hold support, if you will. And it's usually support that lasts on average about 30 to 90 days. And the idea behind this is really to do a more in-depth assessment of the situation, identify what the needs and the gaps in services are, refer to the most appropriate resource in the community. So this could be also resources where further application forms are needed, for example, in order to access those services. A common one, if people are aware, is like a wraparound service that's offered through Crossroads and the Youth Services Bureau, for example, will require a bit more hand-holding and application at that time, or some of the intensive mental health services as well. So what we'll do is we'll meet with the family, we'll develop a plan of care, we'll reach out to any of the resources that they're currently connected to, whether it be the school, social workers, Children's Aid Society. We really work in collaboration with their team of support that's in place. We'll explain the various service options to them. We'll advocate for services on their behalf. We can also present their case to the resolution committees in their area and provide liaison with these. So sometimes a lot of these families are in dire need of respite. So it's about putting in that application, advocating for some funding to get them some respite, especially while they're waiting for services. As we know, some services can take several months of wait lists before they're accessed. So again, that's part of what we'll offer too, is sometimes it'll be not that we don't know where to send them, but that they're going to sit on a wait list for a period of time, and that could actually exacerbate the situation in the meantime. So we can help support. We're both registered mental health workers, so we can provide some brief psychotherapy as well as needed to youth of 12 up or their families. This is a little extra piece that we can offer. And so yeah. I was really making sure that it was 10 minutes. So it's us in a nutshell. I don't know if anybody has any questions or clarification needed.
I've not seen anything in the chat, but feel free to raise your hands and write in the chat if there's anything you want to ask Michelle. Thank you, Michelle.
Yeah, so there's information here for the website and whatnot. As I mentioned, they will be sent out. Sure. Well, thank you. A question come in the regular chat.
Yeah, no question.
Yes, so for yes, we will connect to mental health agencies, community mental health agencies where there are no fees. We can provide lists of fee for service providers as well when the family requests it. But for the most part, we try to match as much as possible to the community-based publicly funded services. For the one call and click, and normally to get an intake with one call and click, for the most part, we're booking within a week. So it's usually fairly quick. We often have openings. It really depends if they really need that like 6 p.m. time slot. They may wait a little longer if they don't have flexibility in their schedule. But for the most part, they're seen within a week. So complex and acute, absolutely. So the acuity, we base it on, during the intake, there's an assessment that's done. They use the HEDS-ED is the assessment tool that they're using. And so we base it on what the score is of that particular HEDS-ED. So we're also looking for, is there like a high conflict within the family? Is there not attending school for long periods of time? Is there suicide risk, harm to others risk? So all these bases are evaluated and for the acuity piece. And the complexity, it's really a case by case. We're looking for, are we looking at parental mental health? That's a factor. Is there socioeconomic factors that are coming into play that are creating barriers for them? Are there dual diagnoses, multiple diagnoses? So the complexity really is anything that could be exacerbating the situation or creating barriers for families to access the services that they need. Yes, absolutely. Recent trauma in the family would absolutely add complexity. Anything else? I'll hand it back to you, Mariana.
Okay. Thank you so much, Michelle. So if there are no questions, we'll go to Genevieve.
Thank you so much. I'm just sharing my screen. All right, everybody can see. So my name is Genevieve Mosher. I'm a public health nurse in a nursing project officer role, and I work for the Healthy Growth and Development Program, which is within the Parenting in Ottawa portfolio, and we are all with Ottawa Public Health. So all these services that I will be sharing today are within Ottawa Public Health. Thank you so much for having me. Just a bit of background on me. I've been with the program with Healthy Growth and Development for almost 18 years, and I've been a nurse for almost 20 years now. And I do have some background in the hospitals as well. So I worked at the NICU at the General for a little while, as well as labor and delivery. So this is me. So I'll dive right in because we don't have much time. So we do have many services within the Parenting in Ottawa portfolio. And really our services are designed for the families. So throughout pregnancies and for parenting, needs, we also cover for youth as well. So I will go more in details on all the services or some of the services that we have that I felt maybe you may be interested in. But where you can access our services after this presentation, if you have more questions, if you are needing some specific information, please go to our website that's in this slide, Parenting in Ottawa. I believe the slides will be shared after the presentation as well, so you'll have access to all the links and all the information. You can also visit us on our Facebook page. We have a lot of information that is shared. We used to have some topics that were moderated, but at this stage, it's really just to share information with clients and with our partners. So please like us on Facebook. We also have, I should have actually put it in there, and I realize that now, but we have a YouTube channel with Ottawa Public Health where we have many videos that are really interesting, and depending on the topic, the hot topics of the time, you may find some information. For example, RSV, we did have a video for a while circulating, but I welcome you to our YouTube page as well. You can easily find it on YouTube by searching Ottawa Public Health. And you can also please visit us at one of our many services, which I'll go in details in a few slides. So many services are available through our Parenting in Ottawa portfolio. So this is a list of the services or some of the services. There are more, but I just posted the most important ones that I felt would be useful for your knowledge. I will focus on a few of the services in the next slide. In the next few slides, I mean, so you're aware of the current services that are being offered and where immunization clinics are located and such. So I'll go more in details. So to start, our health and neighborhood wellness hubs are located across Ottawa. So these hubs were initially created during the pandemic because a lot of the marginalized clients and communities were disproportionately affected or impacted by COVID-19. So this is why these were created, and we kept them because we noticed they had a really great purpose. They were helping a lot of the families who face many barriers accessing services. Like, for example, some of the services that are available are vaccination, dental screening. We also have employment and social services at some of the locations, diabetes screening. We also cover Aging Well in Ottawa resources and services, as well as the Champlain Screening Outreach Program is at some of our hubs location. And we recently have added some pregnancy circles in some of the locations. So I believe this year we'll have 3 locations offering prenatal classes for more vulnerable families. As well as one of our Parenting in Ottawa is currently at one of the locations. So, and this is very useful for families who don't have access to primary care provider, because at one of the locations, which is the Bayshore Field House in the West End, you can access this location, have your baby weighed, and you can also access immunization. So it is very useful for a lot of the families who are struggling right now with getting some care for their newborn. So trying to fill the gap where we can. So this is for the hubs. You may hear them as the hubs. So, but they're great. And please access the link on this slide if you want to know more information about the locations and specific services. I did add this map just to give you an idea of where they were located in Ottawa. So if you locate 10 locations and strategically located where families are needing more services. Moving on to immunization. So we do offer immunization for routine services, and also a lot of resources on our website for immunization for parents, but also for professionals. So please visit our website if you want to know about, for example, Can Immunize app or the routine vaccination, where to access. Where you can make an appointment and visit one of our locations. I just have to add that their mandate is for children at this time, so we're not really open for the whole family. They will make exceptions at times, but really it is for the children who are missing or who need some catch-up vaccination. We also have some short teaching videos that you may find useful with your clients. So I welcome you to access our page and visit, or even they are posted on our YouTube channel as well. And so this is the link is there if you want to know more information about where exactly to access as well. And we do also have a clinic for First Nation, Inuit, and Métis located at the Wabano Vaccination Hub. So for the vaccination clinics. Prenatal resources. So there is currently a gap in Ottawa for free prenatal classes. So most of the prenatal education available is either virtual or clients need to pay. So we are trying to fill that gap with some of the prenatal videos. So you may be familiar with our Here Come Baby series. We have just recently created some new how-to prenatal and parenting videos. The link is on the slide. But you can essentially learn about 8 different topics, for example, like how to manage my baby's gas, how to cut my baby's nails, what to do, how to time my contractions, and things like that. So there's 8 topics that we felt were the most popular, or some of the most popular topics. So I welcome you to visit our page and to use them as a teaching material for your clients if you are needing this type of information. And they can easily be shared with the YouTube link as well. And we also have a lot of prenatal resources on our page. And also we do share information from our community partners. So we have many community partners who are offering prenatal services that are free. So please access one of the links on the slide to know more. We have started the pregnancy circles for more marginalized clients. So again, this is it's not for the wide population. It is for clients who are needing more support and who are more vulnerable. For example, newcomer families and such. At this time, this service is only offered to moms, but so far it's going really well. We relaunched them last year, so it's officially been a year that we have the new and revamped pregnancy circles. And they are currently facilitated by a public health nurse and a community engagement team member. So the duration of the classes is for 6 weeks, and it's about an hour and a half per class. So it's great. Clients so far, there's great feedback. Like I was mentioning, we provide transportation. If a client cannot access the services on their own, we do have Presto cards available, and we can even support sometimes with taxi services depending on the situation. And we also offer a light snack. And at this time, we still have some incentives. From the pilot project, we were able to purchase some items. For example, we have some gift bags and we have some Walmart gift cards that we are still offering while supplies last. So if you have any clients who would benefit from this great prenatal class, please register them. The link is posted on this slide that will be shared with you. So for this year, we have 14 sessions planned. So our spring sessions are about to start after the March break. So it's a good time to register clients if you know anyone, or they can even self-refer. Within our Parenting in Ottawa services, we also offer the Parenting in Ottawa drop-ins. So parents all over Ottawa can visit one of our locations every day of the week. So if they, and this is a service, mainly we see babies, but honestly, it is for 0 to 6 years of age and also prenatal. So if you know of a prenatal client who would benefit from consulting a public health nurse, this is a great location to send them. But also for babies who are needing a quick way in between, doctor's appointments, or for someone who doesn't have a doctor, this is a great location. We also offer free lactation consultant services on site. I do have to add that we typically only have about 15 minutes per client at this stage because we see quite a bit of moms. If a mom is needing more services, we will refer them to other resources or services. And we also have some pumps available in most of our sites. So at this time, we have 10 locations. We will have a few more in the next few months that are going to be launched. And we try as much as possible to partnership with our community centers and also the hubs when it's available. We do have a calendar that we send monthly. If you would like to be added to our distribution list, please email me. I will be happy to send you the monthly calendar. And just to give you an idea, last year we saw 2,665 families. So we do see quite a bit. This number was much higher before the pandemic, but we are slowly building back up. So we service quite a lot of families, and we get a lot of really positive feedback from families accessing. So to give you an idea, this is where our current locations are. One that is not listed is the one at the St. Mary's Outreach, which is only for St. Mary's clients who attend services there. And the two new additional locations will be posted once they are officially released. And this is our calendar that we send out every month with the locations, dates, and the address, and a QR code that leads to more information if clients are needing some additional services. So moving on to our Steps to Wellness program. So this is a new program that was launched by our Healthy Growth and Development program last year. 6 of our public health nurses received an in-depth training on cognitive behavioral therapy, and they're now able to facilitate a 9-week CBT group sessions. It is a virtual program. And it is offered in French and English. So for 9 weeks, clients can be in a group learning about thought records and other really important concepts on how to manage some of their anxiety and depression. It is offered for prenatal moms or prenatal clients or parents who have children up to 18 months of age. So we do have some criteria. Please visit our website. The link below will lead you to our webpage with all of the criteria and how we determine who is eligible or not. We also complete an EPDS scoring to assess the level of depression and a GAD-7 score to assess the level of anxiety. So some clients don't always benefit or don't always qualify. If they don't qualify, we refer them to alternate services. And at this time, we are also exploring offering a dad's group, so a father's group, possibly in the fall. So this is still very early stages and more information to come, but we are hoping to open the criteria to people who identify as fathers. So, and then we are finishing the winter sessions now, but this is a great timing if you know someone who would benefit. We have our spring sessions who will be starting after the March break. So clients can be registered at the link on the slide. And if you have any questions, you can feel free to also connect with me directly. I'll be happy to answer questions related to this program. And then the last program I want to discuss today or share information about is our home visiting service with our Healthy Growth and Development program as well. So we do quite a lot of visits. Last year, we visited over 8,000 families. And this is a bi-weekly scheduled appointments with a public health nurse. We also have a social worker for more complex situation. So this is mainly the main purpose of our program is home visits, along with the other things I mentioned earlier. But clients do need to meet certain eligibility criteria. So please review that. If you are thinking to refer a family, just make sure that they do qualify for the program. Things have changed in the last, I would say, 6 years. We used to visit all the families, and now, unfortunately, we can only focus on the more vulnerable. And we will refer clients to other services as needed. So I added the links directly on the slide. If you know someone, or if a client would like to self-refer, the two links are posted on the slide. So thank you so much for listening to this presentation. I'm happy to answer any questions. I'm going to look in the chat. Just going to stop sharing my screen.
Thank you, Jenny.
Thank you. Is there any questions?
No questions yet.
Okay. All right.
Sorry, I'm just gonna say, it looks like in the chat there are 2 questions, not in the Q&A. So we have 2 good questions in there for you.
Any places? So for the prenatal vitamins, we don't actually provide this. Sorry, is this what I'm reading properly? Access prenatal vitamins. Yeah, so I would recommend for clients who don't have access to this, really important resource prenatally, to connect with their primary care provider if they have one. If they don't have one, or if they have a midwife or another healthcare provider supporting them during the pregnancy, they often will have some available to provide for free. But this is not something that we do with our home visiting services. Repeat the name of the screening tool you use. So for the CBT, I think that you're referring to the EPDS. So is the Edinburgh postpartum screening tool. So this is a tool. It's 10 questions. You can probably Google it if you are looking for exactly what it is. It's very widely used. So we can have a score up to 30. So if clients score 3 on every questions, it can be up to 30. And one of the questions is about self-harm, but it really is to assess the level of depression and where clients are feeling more vulnerable, like which segment, so we can really explore. And we also use the GAD-7. So this is for the anxiety tool. So I don't know if I'm answering your question, Gwen. Yes, so thanks, Beth. So DADS group, more info to come. We're working really hard on that. Don't see any other questions. I don't want to overtake.
Any other questions? And even the Q&A, I don't see anything. Lisha, did we miss anything? We're good?
Sorry, and I'm not sure about there's a last question about, Danielle, thank you. I'm not sure if it's free, maybe. I don't know this resource, fortunately. But thank you so much, everyone.
Thank you. And then we'll hand it over to Kristen.
Hello, everybody. Okay, I was having trouble unmuting myself. Do you see my presentation? Perfect. Well, thank you everyone for being here. My name's Kristen Holinsky. I'm the Executive Director of the Ottawa Parent Resource Centre, and I'm here to talk to you today about our parent support line in particular, and a little bit about our organization more broadly as well. So we are a not-for-profit charity that's helped to build confident, resilient families. We've been in the Ottawa area working for over 50 years. We have a number of programs and services that are open to all parents throughout the Ottawa region. And we welcome parents, youth, children, and caregivers, as well as professionals into our programs, which I'll go into in more detail. Here is a broad overview of our programs and services at the Parent Resource Centre. We are an early on child and family center, so we have playgroups 5 days a week that are drop-in free. We provide information and referrals for parents to different services throughout the city. We have a parent book lending library and a toy lending library as well. Our parent support line, which I'll get into more detail in, but it is free, confidential. It's a call-in service, open Monday, Tuesday, Thursday, Friday from 9 to 4, and Wednesdays we have a later time from 11 to 7. You can call in, and you can also email to book an appointment. We have parenting resources on our website. We have workshops that we offer in the evening, free workshops. We have parent tip sheets. We refer to community partner programs, and we work with community partners. So we have different partners in our space who offer different programs and services as well. We offer referrals, and we have special events throughout the year. a new tool that we've launched in the past year that some of you might be interested in. So please jump on our website and take a look at it. It's our incredible Playgroup Finder. It's a really fun, accessible, easy to use search tool for parents and professionals. And it links to early on playgroups and free playgroups and programs throughout the city. So it has a searchable map and really easy drop-down filters that you can go on and search for playgroups and programs throughout Ottawa. Something that you can be referring your clients to. Our Family Resilience Program offers parenting support and services, including parent support groups and in-home parenting support that I'll go into a little bit more on. So this is short-term situational counseling, systems navigation, advocacy for clients, and one-on-one client support. And finally, we do sector training for frontline professionals. So we host communities of practice, do professional development, early years sector training, resource development, and consulting. We serve a number of families throughout the city. We have a physical location in Sandy Hill, but we do serve the entire Ottawa area. So our early on program has just under 4,000 visits a year. We serve well over 2,000 professionals a year, and our Family Resilience Program sees over 5,000 clients a year through the various touch points that it has, and we're continuing to grow and expand and build our partnerships as we move forward. So our Family Resilience Program is one of our flagship programs at the Parent Resource Center, and it has 3 main pillars under it, one of it being our Circle of Security Parenting Group, another being our in-home parenting support, and the other being our parent support line, which I'll focus on, but I'll touch on all 3. And really what you can expect from us under this program is that we're going to offer client-centered, trauma-informed services. Then these services are available to all parents and caregivers in the Greater Ottawa area, and they're for families that have children from birth to 18 years of age. And so anyone is eligible to come and take part in these programs. And so we serve, as I said, all families with children from birth to 18, and this can include caregivers, so grandparents, adoptive, foster families, home childcare providers, early years childcare professionals, those working in early on, social workers, psychologists, really anyone working with parents and families and professionals. So we're here to support everyone and anyone working with children. And we tend to receive the majority of our referrals from CAS, from schools, hospitals, community health centers, legal firms, and self-referral as well is available. Our parent support line itself, there's a direct call-in number. It's free, confidential, it's non-medical. We have registered social workers answering the line. It is available Monday through Friday from 9 to 4 in terms of standard hours, but Wednesday, as I mentioned, we have a later call-in time just to provide an evening call-in time for those where that's more suitable for them. We do have an email, so people can email in and book an appointment as well if they want to do that, if that's more convenient for them. But it's an accessible call-in service that anybody is able to access. And really the goal of what we're looking to do on this line is to really support families and increase the functioning and parenting capacity of the family. So if a family's calling in with any kind of parenting challenge and question, whether it's from sleep and routines to anxiety in children, to behavioral issues, to school avoidance, to challenges with different public systems, we can help. We're here to really support and foster the healthy development of children and support behavior and growth and healthy development, and support parents in ensuring that their children are meeting those stages, and to support really positive parenting and to support the parent-child relationship through attachment-based support and advice. And then we could also refer clients to other services and support them in transitions to other kinds of programs, services, and supports within the community that may be most appropriate for them. So what does support look like when you call into the line or access really any of our services through the Family Resilience Program? Well, it's really short-term situational counseling as it really relates to parenting stressors. So again, we have trained and registered social workers who are answering the calls. They'll help with systems navigation if that's the issue. They can support in advocacy and working collaboratively with other local service providers, whether that be schools, CAS, or other providers within the city. And we can provide education and support and advice on different kinds of topics related to, but not limited to, behavior, attachment, temperament, child development, building those healthy relationships, parental stressors, so making sure the parents are in a really positive, healthy place themselves, and self-care, just general health and safety for children's well-being, and establishing boundaries, rules, and routines for children, among other things as well. Through our parent support line, other programs and services that are available at the PRC that families may be referred into or may find helpful, and that they can be referred into through calling through the parent support line, include our Circle of Security parenting group. And that is a virtual online parenting program. There's an intake process for that, but it's open again to all of the Ottawa population for those from birth to 18 years. It's an 8-week session. It's supported by our FRP team, who are trained social workers, registered social workers, and participants to receive credit of completion. Professionals can take this course as well. And it's really a program that is based on attachment theory and supporting parents and caregivers in building and strengthening secure parenting relationships. And for those who come through our program who are more marginalized, vulnerable, or higher risk, we do have an in-home parenting support program where our team will meet one-on-one with parents and families, whether that be in their home, at the resource center, in the community, wherever they feel safe. And again, that we're there to help parents build healthy, supportive relationships between parents and children, to help them make sure that the children are meeting those age-appropriate milestones, behavior guidance, and any kind of advocacy and collaboration that we can help with different community partners as well. So really, there's no cost. Anyone can access these services. The PSL does offer one-on-one appointments via call-in or email support. You can call during schedule hours, or you could reach out during outside hours. And if someone isn't available to answer during our standard hours, then your call will be returned within either 24 hours, if during the week, or 48 hours on the weekends. And there's no wait list for the PSL. And for our other programs and services, there's sometimes a short wait list, and it's really on a first come, first served basis. So that's us in a nutshell. I know we have another presentation, so you will get these slides. Happy to answer questions. Our contact information is on these slides as well. And we are also, you can find us on LinkedIn, on Instagram, on Facebook. Come visit our website, check out our incredible playgroup finder, and you can also sign up for our newsletter on our website if you want to receive more regular updates.
Thank you, Kristen. I don't see any
I think there are a few questions actually in the chat for you, Kristen.
Okay.
Maybe in the chat, not the Q&A.
Yeah.
I do see, are there any interpretation services available? So we have arranged interpretation on a case-by-case basis if needed. So yes, that is something that we can work with a client to do if that is needed. Yes, professionals can absolutely call the PSL. We get quite a few professionals calling in. So if you're looking for resources, systems navigation yourself as a professional, you're absolutely welcome to call in.
Just want to make sure. Any other questions? No, thank you, Kristen. Then we'll hand it over to Daniel.
I feel like I've learned so much already. I knew all the organizations, but I always learn more about programs. So hello, everyone. My name is Daniel. I work for Community Navigation of Eastern Ontario. You may know one of our programs better, so 211. Let's see here. So I work for Community Navigation of Eastern Ontario. We run the 211 program for Eastern Ontario. So that's, I was listening to Michelle earlier talking about the Champlain region. We cover that and a couple more counties. So we're from Belleville, Hastings County, all the way up to Renfrew County, and then to the Quebec border in the east. It's a program. 211 is available 24 hours a day. 365 days out of the year, and we are the French language services center for the entire province. So our colleagues in Toronto also speak some French, but not as much French as we do. So a question I like to answer, or I like to ask when we have more time to the general group, is what X11 numbers do you know? A lot of you will be familiar with some of them. Obviously, 911 is one that most people will know. 811 is relatively new to the province, so non-urgent healthcare telephone triage services. 711 is message relay. 611, if you have a cell phone, that's your telephone company. 511, provincial weather and travel information. 411, directory assistance. 311, City of Ottawa. And 211, that's us. We are public information and referral services. So we provide information and referral to the most comprehensive database of community, social health, and related government services in Ontario. We're the first point of access to human service resources throughout Ontario. What does that mean? My mom would say, qu'est-ce que ça mange en hiver? What does that eat in the winter? What does it actually mean? Essentially, it means that you can get live confidential help from 211 navigators. So you call in and you answer English or French, and if you want to do a survey or not, and you talk to a real person, which is always nice. It's free as well, no cost to access. A lot of Geneviève, Michelle, Kristen were talking about interpretive services. We also have access to an interpreter service, so any language that you or people around you might speak, we can get an interpreter on the line to help translate. We are also standards driven. So that means that we have to go through accreditation every 4 years as a center, so that if you're calling 211 in Quebec, BC, Los Angeles, or right here in Ottawa, you'll have pretty much the same experience when you call 211. A lot of people wonder who funds us. We are a nonprofit and a registered charity, but we're primarily funded by the province. So Ontario Ministry of Children, Community and Social Services and the United Ways of Eastern Ontario. A lot of cities, counties and municipalities also fund us, but right here in Ottawa, United Way East Ontario and the City of Ottawa are our main funders. What we do on a day-to-day basis, we answer questions, so public inquiry. So people call in, whether that's people calling for themselves, people calling for family members, neighbors, or people calling for their clients. It's always easy to think that we know a lot about the human services sector until we have to answer a question that we've never run into before. And that happens to us all the time. We actually have 60,000 resources in our database, and it's impossible to know all of them. I was taking a quick look at the questions in the chat to see if I can answer some of them, but that's the nature of the beast. You never know which question you're going to get when you're on the lines. So a lot of people call us. In Ontario last year, so we got 266,000 calls, chats, contacts from all over Ontario, and just over 25,000 in Ottawa. So you can dial 211 to access, no area code needed. If you can't dial 3-digit numbers from your phone, you can always call the toll-free or the 10-digit. That has something that sometimes happens with internet phones. And when you call in, you'll be answered by specialists. So our community navigators who either have a certification in information and referral or in the process of getting it. We always work with people. I was listening to a presentation earlier, complex needs, ongoing needs. We get all sorts of questions. So sometimes it's what's the number to my local library? And sometimes it's 4, 5, 6 things at the same time. Who answer these calls? Our community navigators. So they go through extensive training to answer questions, search our database, defuse situations, and they are required to get certified in information and referral and to maintain that certification through ongoing professional development. So I will not necessarily go through all of this, but suffice to say, we need our community navigators to be interested, curious people that always want to be learning, whether that's learning about new resources or learning about how to access resources, current needs and trends in the province. In the basic process of information and referral, essentially, sometimes it's just answering questions. We just provide information. People call in, they have a question. Any of you today, if you were to call 211 and say, oh, I forgot to write down the phone number to One Call, One Click, or to the Parent Resource Center, you can always call 211, even if it's 3 a.m., and you can ask for that information. If you have a problem and you're not quite sure what the answer is, or you're not quite sure where to find the information, you can always call 211 as well. We're used to answering a question and trying to see if there's a need that can be pulled from that, and if there's a program that can serve that need serving that area. So essentially, we're always there to help people figure out what is that they're looking for and to see if that exists in their area. We also do provide some advocacy if people are calling in and they want a warm handoff to an agency. Sometimes we're able to do that. If people aren't quite sure where to start, we can set them up with a few resources to contact, and we can offer a follow-up a couple days after that. If people are not quite sure, we can ask them, do you mind if I call you back in a couple days just to see if you were able to get through? And if not, we can look at other alternatives. We also do have an online portal. So we have a provincial one, 211ontario.ca. You can actually go yourself. It's the same information that our community navigators have, but a pared down version for the public eye. So you can search yourself in 211ontario.ca for all of the community services in Ontario. So whether that is food programs, schooling programs, housing programs, homelessness programs, we try to include as much as we can. You can also access the regional portal, 211easternontario.ca. That's essentially a more pared down version of the provincial one. So it's more focused on Eastern Ontario and its resources. It's broken down by category, and those categories are broken down further. So if you're not quite sure what you're looking for, but you know it has something to do with housing, you can click on the housing and see what are the options. If ever you're not able to find anything on our website, I do encourage you to call in. Our people on the lines, they are curious, empathetic people who are looking to help people as much as they can. So if you're accessing our resources online by yourself, all the information that we have is there. So whether it's the description, what the eligibility is for that, the service area, if there's an application process, if they need to bring documents, if they need to contact someone specific, all that is on our website. And I'm sort of flying through this, but you'll get them via email, so I'm not too worried about that. If as a service provider, you have new programs that you want to tell us about, please let us know. Please send us an email, give us a call, and we'll be happy to include any new programs in our database. That's what we want to do. I'll talk about the different needs that we identify in Eastern Ontario and in Ottawa. We identified about 33,000 needs last year that were listed in Ottawa. You might notice that that's higher than the number of people that called. That means that there's more needs per caller than just one. So a lot of people are calling in with either 1, 2, 3, or multiple needs. A lot of what people call us for are things that you were very familiar with: utility assistance, food banks, housing services, homelessness services, shelters, and those who work in social services. You'll note that this is the start of income tax season. So if people are looking for a place to file their income tax, please let us know. We can help you figure out where to go. The people that also work in the social services sector know that school supplies and Christmas baskets are also a popular call in the 2-in-1 world. We also track unmet needs. So this is useful to our funders and partners because we can give people a sort of a viewpoint of what the needs and trends are. If we see that there are a lot of resources for food or meals in Hawkesbury, we can let them know that we were able to refer. But if we weren't able to find anything, that's something that can be very useful to funders and agencies to know about, so they can put new programs into play whenever they are needed. I always like to talk about the people who call. I actually started out on the lines here at 211 almost a decade ago now. It's weird to think about that. But I like to give the example of I took a call from someone in July. They were a new mother. They were looking for a food bank. They had never accessed a food bank before. So they had all the regular questions. So where's my food bank? Do I need to bring anything? Do I need to bring a bag? Do I need to bring ID? Do I need to bring a list? All these questions that you would have if you've never accessed a program. Through discussion, we talked about how she was accessing a food bank for the first time because she was getting her Canada Child Benefit cut off. She hadn't filed her income tax. I was able to find the food bank and then circle back and say there are year-round income tax clinics in Ottawa that you might be able to access. So through that, you can see that having someone who is curious on the line, who knows about the social services system, we can help people identify needs and resources that they may not be thinking about. And I know I'm talking a little bit about the client perspective there, but I'd like for all the service providers on the call to think of us as a friendly colleague, that if you've done your research on your end and you can't find anything, please give us a call. We can always take a look to see if you might be missing anything. You are all professionals in your own domain, but there are a lot of resources out there. Even we don't know all of them. The only way we can find resources is through a well-ordered database and experience from years of searching. So if I can leave you with one, I have examples of why people would call 211 here. So whether it's accessing the library, looking for someone to volunteer, legal aid, if I can leave you with one thing is you can always call 211. We're a great place to start. I like to say that we're not necessarily the last place that people will have to call, but we're a great first place because we point people in the right direction. And I think I didn't go over time.
Thank you so much, Daniel. It's that it takes a village, right? And as professionals, I think we need to collaborate and do it together for us to make that meaningful change. There are some questions for you on the chat. So not the Q&A, the chat.
Okay. So let's see here. So 211 is also for Anchor Now. Yes, that is the alternate neighborhood crisis service, only available in Centertown for now. But you should be getting more information about that tomorrow. There should be some press releases about the first evaluation period. So are there any details on how the process of connecting with Anchor works? It seems 211 has a lot of connections, resources they offer. So connecting with Anchor, that's the alternate neighborhood crisis response service in Centertown. That's a collaboration between us, the Centertown, and Somerset West Community Health Centers, where people can call to get an intervention if someone is having a mental health or addictions crisis. Right now, to access the Anchor, you can actually call in, and there will be an option on the menu to opt into it. If ever you miss the option and get through to the regular 211 line, that's no worry. They can just transfer you back, so that's no problem. Oh, and I see that there's an answer. Crisis would be triaged and 211 would determine whether to involve police or not through Anchor, which can be harmful at times. We love confirmation. Yes, essentially through our intake process, we determine whether that's a call that can be answered and responded to by the Anchor team, or if it's more appropriate that there's another program that responds to it, whether it's walk-in mental health clinic or anything else. Can you tell me a little more about Housing First? Do you all help connect an unhomed person to shelter, place to live rather than a temporary shelter? So we don't do that process ourselves, whether that's referring to a Housing First program or referring to a shelter intake program, or it's referring to a specific housing program. We would take a look at where the people are, what their needs are, and try to refer them to the right place. So depending on what the person is, we look at their conditions and try to match them with something in their area. I hope that answers the question.
Yeah, and I see that time is up, so want to thank everyone again for joining us. Your participation and great questions are appreciated. And thank you to the Just Ask partners and presenters. We appreciate your collaboration. I think in terms of if you have follow-up questions, Lishai have written some things in the chat that you can still send your questions, and she will send them to the presenters. And there'll be a follow-up and another French version of this session next week, Wednesday at on March 5th at the same time. So please, we'll appreciate it if you join us. Thank you again for coming, and we really appreciate your time. Thank you.
Thanks for having us.
Thank you.